Despite showing body bags of patients who have lost their lives due to COVID-19 and recent images captured in hospitals where COVID patients are receiving treatment, many people are still skeptical of COVID-19. EMTV News visited Mount Hagen General Hospital today to see firsthand how the hospital is coping with the surge of COVID-19. As of September 17 up to this morning, a total of 1,139 persons tested positive, while 22 COVID deaths recorded in Mount Hagen General Hospital. 75 of them are isolated at the isolation center, and 77 hospital staff, including doctors, nurses, and others, have been infected with COVID-19. Hospital CEO Jane Holden said they are yet to get the results of the Delta variant, but evidently patients are very ill and it is spreading faster. The surge and the financial constraints placed on the hospital have forced other hospital services to shut down. The hospital chapel, surgical wards, and the TB ward are turned into COVID isolation centers.
The number is increasing at the rural facilities as well as the hospital. Even in the medical ward, we are testing people with patients with COVID. In the A&E, we are testing people with COVID too. Everywhere is COVID, including the surgical ward, the ONG ward, everywhere is COVID. So first we thought that we will keep patients only in the COVID ward, but now we are seeing that everywhere patients are coming in, they're ending up with COVID. So we are trying our best to keep our patients in isolation, but that number, we cannot meet it.
This morning, patients queued at the Persons of Interest tent, waiting for a space to be made available at the isolation center. There were also people waiting outside the clinic to get tested, and more people are coming in to get vaccinated. Laboring mothers who have tested positive for COVID-19 are isolated at the isolation centers and are delivering their babies there as well. Staffs are working extra hours and are exhausted.
The track that we are taking is very dangerous, as staff are going to become sick either with COVID-19 or they will experience stress-related illnesses. And I am afraid that eventually we will not have staff to take care of the sets that we are experiencing now currently.
There is need for oxygen, gas cylinders, and consumables as more COVID patients are admitted. The hospital is still waiting for its remaining funds to be made available to be able to open other services and cope with the COVID-19 surge. Janet Yamu, National EMTV News, Mount Hagen.